Welcome to Arirang Live. It's 11 a.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the South Korean health authorities on the COVID-19 outbreak. There are regular briefings given twice a day, one at 11 a.m. and another at 2 p.m. by the Central Disease Control Headquarters. South Korea has confirmed 30 new cases on Saturday morning, which brings the total number of confirmed cases to 10,480. With 3 additional deaths, the death toll has now reached 211. And over 7,200 people have fully recovered and been sent home. The briefing is now about to begin, so let's take a listen.
Here is Mr. Yoon Tae-ho for the briefing on the coronavirus outbreak. Let us now begin our regular briefing for April 11th, Saturday. As of today midnight, we have a total of 3,026 who are in quarantine and 7,243 have been discharged following full recovery. We have 211 fatalities so far. Yesterday, we had 30 new cases and 126 more people have been discharged following full recovery. Unfortunately, we had 3 more fatalities. I send my deepest condolences to those who have passed away. Of the 30 cases, 18 were confirmed here domestically, and a total of 12 cases were were related to overseas. And also, we had 6 imported cases at the airport quarantine and 6 through community transmission. And 10 are Korean nationals and 2 are foreign nationals. And Prime Minister Chung Se-kyun convened the KCC meeting this morning, and he was briefed on the tightening of the screening for those who are coming in from abroad. And he also mentioned that we had no new cases in Daegu yesterday. And also he said that this was possible due to the dedication put forth by the medical staff and the people of Daegu City. He also thanked them once again. And regarding the second day of the reopening of the schools through online classes, he said that we need to discover great case studies for these online classes so that others can benchmark them. And he also touched upon the issues of introducing the use of electronic wristbands for people who violate self-quarantine regulations. Today, the number of confirmed cases is 30, which is similar to yesterday's 27. And aside from the Seoul, Daegu, and Gyeongbu province, 12 municipalities to see no confirmed cases. And compared to weeks before, we have seen a 40% decline in the number of confirmed cases. And we believe this was possible thanks to all of the support given by the public who took part in the social distancing campaign for the past 3 weeks. We thank you once again. However, we are still seeing a decline, still seeing cluster infections because we cannot let our guards down as of yet. We are still seeing cluster infections, and we are also seeing an enhanced outbreak globally. This is to a certain extent, it is hopeful. However, after the 18th of February until the occurrence of the patient number 31 here in Korea, we had a gap of 1 month, so we cannot let our guards down as of yet. And still, we are witnessing cases that have unidentified infection sources, and we still have about 3,000 people who are being treated at hospitals and live treatment centers, and the fatality rate is over 2%, so we cannot let our guards down yet. And we are also seeing cluster infections continuously in the metropolitan area, and we believe that this could lead to widespread cluster infections any day. And today's new confirmed cases was also possible and are the results of the social distancing measures put in place 2 weeks ago. And I ask all of your support going forward so that we can curb the further outbreak going forward. And during the weekend, we advise you to refrain from going outdoors, especially going to going outdoors to see flowers, or the campaigns for the elections, as well as the religious activities for the Easter holidays. And also here is the following on the intensified measures for those who are on self-quarantine. We are seeing an increase in the number of those people who are on self-quarantine due to the number of people who are coming in from abroad. And we have seen continued issues of those who are failing to comply with these measures. And taking the account that these people put danger of the community health as well as their own, we also decided to put the use of electronic wristbands for these people, and we are also mulling over the intensifying of these screenings and control by upgrading these applications to track their movements, and through Bluetooth this will be synced with their applications on their mobile phones, and if these are destructed or harmed, they would be directly contacted to the responsible officials. And we will also utilize the tracking of the movement function through the application, so that if they are not on the move, they will be also reported to the respective officials. And if they fail to pick up their phones, we will have the respective quarantine officials and the policemen to be dispatched to the site. And we will also have spot checks going on as well to check their conditions. And if they are identified as failing to comply, we will be reporting them to the police as soon as possible, immediately that is, and we will also enhance our punishment for these people as well. And as for the life treatment centers and the number of inbound travelers from abroad is about 20% of the people who have been coming into Korea through weeks before. And also we are seeing a decrease in the number of the short-term visits foreigners, and these people are subject to facility quarantine that are designated by the government. And there are currently 10 facilities, and about 1,600 rooms are possible. And currently there are 1,300 people who have been administered, and we will be opening 2 more facilities going forward. And we believe that going forward we will see a decrease in the foreigners who are on short-term visits, and the government will continuously to monitor these number of inbound travelers. And to react to the coronavirus, we have been strengthening and expanding our coverage for the national health insurance, and we will be making sure that these are made possible through not only physical checkups but also through a virtual checkup through through a telephone communication. And we will provide more support going forward. And for those who are on self-quarantine, if they need to be inpatients and hospitalized, we will also mull over the possibility of having them getting more faster medical checkups and medical services. And also we are providing a decline in the number of the amount of health insurance for those who are self-employed, and this will be also subject to about 700 people who are below a certain income level. And for the next 3 months, we will see a decline in their insurance coverage by about 90,000 Korean won. And during this weekend, we will be experiencing an increased temperature and a good weather, so we believe that many more people will be enjoying outdoor activities, but we advise you to refrain from crowded places. And the coronavirus is infectious through droplets, so we advise you to keep physical distance with each other. This is very crucial. And also when you go to crowded places, you need to keep personal hygiene measures, including washing hands and coughing etiquettes. Through this crisis crisis, we have also witnessed the importance of the value of the ordinary lives. And the effects of the social distancing campaign cannot be carried out if we do not cooperate as a whole. And I know that a lot of the people are going through difficult times. However, many of the medical staff and the governments are cooperating fully to overcome the virus. Thank you very much.
There you have it. And now to wrap up the briefing, South Korea has confirmed 30 new cases on Saturday morning, bringing the total number of confirmed cases to 10,480. With 3 additional deaths, the death toll has now reached 211. We have another briefing coming up later in the afternoon. We'll again be providing live coverage of that session to make sure you're fully up to date with the situation. Bye for now.